Thank you very much, Cian Corlon. I welcome this opportunity to update the House on COVID-19 and our response to it. First and most importantly, I really wish to express my sincere condolences to the family and friends of those that we have lost to this disease since this House last met. I'm conscious that news bulletins are full every night of statistics and reports of new cases and new deaths, but we should never forget, behind every number, every death is a grieving family, grieving friends, grieving colleagues and a grieving community. And that grief is compounded even further by our inability to grieve in the normal ways that we usually do in this country. We think of them today, we think of them every day, and we offer our sincere condolences to their families. Cian Corlon, against the backdrop of such tragedy, I can often feel uneasy even discussing progress when it comes to COVID-19. But I think it's important, in fact essential, that we reflect and acknowledge the difference people right across this country have made. You will remember when I was here last week, I updated you on the modelling work in relation to this virus. The reproductive rate had fallen to between 0.7 and 1. I'm very pleased to inform the House today that the reproductive rate has now fallen even further to between 0.5 and 1. That means for every one person who contracts COVID-19, we now expect that they will spread it to no more than one other person, and hopefully fewer than that. This progress is a huge tribute to the solidarity shown by the Irish people. However, this number is not static. We have achieved this progress by staying apart, and we need to continue to keep that distance. If we continue, we will suppress this disease even more. That is our national goal. We must not give up when we're starting to see that what we're doing is working and is crucially saving lives. And there are other encouraging signs as well. The model shows that at the beginning of April, around 100 people per day were being admitted to hospital with the virus. I'm pleased to inform the House today that the model now shows that that figure has fallen to around 40 people a day, quite a significant reduction. The number of people in intensive care is also falling, and the number of people being discharged from ICU is rising. I thank each and every one of our citizens and our frontline staff for all their work and for continuing with us on this difficult path. When better days come, these will be amongst the reasons why we can be proud of our country and proud of our people for the way they have acted to try and defeat this national and global threat. The significant number of clusters of COVID-19 in our residential facilities is the area of greatest concern, and we have put in place significant measures to protect residents and staff. These measures include infection prevention and control teams, active screening of all staff, ensuring PPE supply to long-term residential care settings and home support providers, 18 COVID-19 response teams across the country, each one led by senior nursing supports, are now assisting nursing homes and long-term residential facilities with senior clinical expertise, infection prevention control and public health input in preventing and, crucially, in managing those clusters. We've established a financial assistance scheme for nursing homes, which is open for applications. As already mentioned, now that we have additional testing capacity, and I want to commend the HSE for their excellent work on this, we're now prioritising the testing of staff and residents in these facilities. By the end of today, 18,000 tests will have been carried out in long-term residential facilities, and I want to thank the National Ambulance Service for the heroic work that they've done in recent days since this started last Friday, I believe. Tonight I will meet again with HIQA, the HSE and the Chief Medical Officer to keep a continued focus on this area. I'm aware there's been much speculation and discussion surrounding the potential easing of restrictions from May. I understand why. It's human nature. I know it's the thing that, quite frankly, keeps many of us going. That need for a light at the end of the tunnel. Families missed, friends missed, the simple things in life that we took for granted, that we now really, really miss. And I promise you, we will set out the next steps. But I need you to keep focused on the here and now, because the here and now matters, and what we do in the next few days matters. In order for the National Public Health Emergency Team to make these decisions, all of us as a people have a job to do. It involves staying the course, it involves sticking with it involves washing your hands, coughing into your elbow, keeping your distance, cocooning and protecting yourself. Things perhaps we're tired of hearing and saying, but things that are vital in the next 12 days. COVID-19 is a highly infectious disease. We're fortunate that the measures we've taken are reducing that infectivity. But we are by no means in a safe place. And I have to say that. We are not in a safe place. If we had to decide on lifting measures today for tomorrow, the Chief Medical Officer advises me he would not be in a position to recommend any change. But we are working on a roadmap, which we'll finalise over the next week. And this will allow us to have a frank and honest conversation with each other about the weeks and months ahead. one that must acknowledge that increased movement carries increased risk. There's a very thin line between where we could have been, where we are, and where we may yet be in relation to this virus. When I think of the roadmap, Ceann Comhairle, I think of it as a new social contract between government and the people, a way to try and get our country back on track. This will require the involvement of every single part of Irish society. It will demand communication and honesty for us on the public health risks, but also consideration on the mental and physical well-being of all of our people. I wish I could tell the people right now what the future holds. We all crave that certainty. But it's too soon. The coming days matter. They will shape our future. So please stay the course and please stay at home. Thank you.
Minister, thank you. Now, we have